Hi, I'm Dr. Ed Beyer, Clinical Director of Beyer Natural Health Solutions in Tinley Park, Illinois. I've been practicing functional medicine for over 32 years, and you're going to have a better understanding of what that means. And today we're going to be talking about the 10 top underlying reasons why you have an autoimmune condition. So my advice is to sit down, relax, maybe have a pen and paper, because it's very compelling information I'm going to be sharing with you today. Like I said, I do practice it's a southwest suburb of Chicago, and we have patients all over the country, so we try to get this information out to you because we know that if you're suffering from an autoimmune condition, that you're getting very little answers from traditional medicine. And I've seen you for 32 years, and so this information I'm sharing with you, I'm very excited to do it, and I think you're really going to like it. So right off the bat, I really want to have a really open and honest and frank discussion on the difference between traditional medicine and functional medicine when it comes to managing autoimmune disease. Traditional medicine it's pharmaceutically driven system, folks. You know, the United States represents 5% of the world's population, yet we consume 72% of the world's pharmaceuticals. This is a very pharmaceutically driven healthcare system. And the other thing is that Big Pharma also controls insurance reimbursement. So one of the things I like to get out of the way right away is this, and it's a message, please don't get mad at the messenger, and that is this. If you want quality healthcare for a chronic condition, which is what autoimmune disease is, don't expect your pharmaceutically driven healthcare system to pay for it. What we do is we get people off pharmaceuticals. So why would a pharmaceutically driven system pay for something that is going to get you off the pharmaceuticals? It just doesn't work that way. And so it shouldn't be that way, I understand, but that's just the way the world is. And so, you know, but the funny thing is we spend money on all kinds of things that our insurance doesn't cover, like our cars, our cell phones, and you know, trips and home improvements and all that. To me, our health, I'm 60 years old, there's nothing more important to me, you know, my family and my health. So, you know, we live in this amazing human body that, you know, 24 hours a day, 7 days a week. So the information I'm going to be sharing with you specifically is how to put your autoimmune disease into remission. All right? And that's what functional medicine is all about. Functional medicine is we do specific lab testing to sleuth out and find out exactly what is driving your immune system to attack your tissue, whatever that tissue may be. And then we go about correcting it, and you can put it into remission, right? And that's what we're going to get into. Now, don't expect your doctor to know, understand, or even accept what you're going to be learning in this workshop, in this seminar, this video. They see things from their pharmaceuticals perspective. And so many of them really aren't open to this. But that shouldn't matter to you, because everything I'm going to be sharing with you today, folks, is in the scientific literature. This is not theory that I've made up or anything like that. It's in the scientific literature. You can go ahead and do Google searches on it. And by the way, when you do Google searches, look at the National Institute of Health results, or PubMed. That's the non-biased search engine that you should look at. Okay, our way with functional medicine, here's the caveat, requires lifestyle change. So if you're totally against changing anything that you're doing, you can just shut this off right now, because it's going to be a waste of time. But what we do, because of the testing, is we know what specific lifestyle changes will yield results. Because many of you out there are guessing. You're going online, and I don't blame you because you're not getting answers from your doctor, and you're going online and you're like, I got Crohn's, I have Hashimoto's, all these different, and should I be doing this? And you're guessing. So this is a system where, and I have a lot of years of experience, where we are going to identify what is triggering your specific autoimmune disease and get rid of the trigger. Then if you go back to that trigger, it's going to come back, right? All right, so let's get into it. I'm getting ahead of myself a little bit. So just to go in line with what I said about insurance, this is right out of the Medicare guidelines, and Medicare is the template of all other insurances, right? So a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. There you have it, okay? Right in black and white. So our healthcare system is very, very good at acute illness. Like if you have an infection, have a heart attack, break a bone, get into a car accident, do it in the United States because our healthcare system's awesome at that. And they're also very good at keeping us alive on medication. But when I do these seminars live, I always ask the audience this question. I want you to think of 2 changes you can make in your life right now that would make you healthier. And you know what I never hear? I never hear this. You know what? I think I need to take more medication, right? So, but what are we going to get? That's what we get from traditional medicine. So, and I know a lot of you are frustrated and you're trying things and you're sick and you're deteriorating and you've lost hope. This video is a message of hope. So please watch it all the way through. At the very end of the video, if you make it to the end, okay, it's a teaser, I'm going to offer you an opportunity to consult with me, either via Skype, telephone, or if you live near my clinic in Tinley Park, which I said is a suburb of Chicago, you can come on in and discuss, frankly, what is going on, what can be done, and what are your options. So that's the beauty of functional medicine, is that it can all be done virtually, right? So we use LabCorp as our lab, and they're all over the United States. It's the biggest lab in the U.S. And the lab kits that we do, these are the tests that we're going to be covering in the video. We send them, via FedEx or UPS. Or postal service. We just send them to you with instructions, and you can collect a sample, the specimen at home, right? And then like saliva, stool, we do finger prick tests for food sensitivities, things like that. It can all be done from home, and then we give you a FedEx label to send it to the lab, and then we get the results. It's a transfer of information, folks. So like I said, I have a patient right now in Virginia. I got one in Las Vegas, one in North Carolina, one in Missouri. So it's getting more and more that way as the world becomes more smaller and more virtual. The consultation information, the lifestyle changes, and all the different exercises that I may be giving you, we can do that through Skype, through email, through phone, etc. And then the nutraceuticals or supplements that we use to get you out of this autoimmune condition, we just drop ship it directly to your home. You get it in a couple days. So it's all very, very possible if you are a good candidate for what we do. So I also offer other 1-hour videos on my website, BeyerNaturalHealthSolutions.com. Autoimmune is the one you're going to get today. Thyroid, we have one on that. Digestive disorders, whole life metabolic wellness and weight loss, female hormone imbalance, and then we also have, next slide here. There we go, chronic pain and fatigue. This one's geared toward people who have like fibromyalgia. Or chronic pain syndromes, seasonal allergies, Crohn's and ulcerative colitis, and Hashimoto's are the 3 specific autoimmune diseases that I've done specifically 1-hour video on each one of those, because those are so common. Migraine and chronic headaches, and chronic neck and back pain. So the symptoms of autoimmune disease are fatigue, weakness, joint pain because you're inflamed. So all your joints ache, you're systemically inflamed, bloating of the gut and body, a lot of digestive complaints, brain fog, a lot of neurological stuff, brain fog, depression, lower libido, mood swings, anxiety, memory loss, inability to focus. So these are all neurological, and you're going to learn why that is. Digestive, as we mentioned, skin and hair problems, visual disturbances, and there's so many more. Now, here are some facts that I really want you to understand about autoimmune disease. This is where your white blood cells, our immune system is our white blood cells. Our white blood cells have one job and one job only, and that is to remove from the body that which does not belong in the body, okay? So, but sometimes those buggers make mistakes, and they start to attack your own tissue, and they lose tolerance to your own tissue, and that's what's happening in autoimmunity. There are over 80 known autoimmune diseases, and that is rising, and so is the incidence of skyrocketing. Folks, think about this, okay? Let's just be real simple. I'm from the south side of Chicago. That's the blue-collar type part of town. The north side's more white-collar. We're more blue-collar. We're very simple, direct people. My dad was a Marine, and he was a union plumber, so that's just the way that I like to teach. So if the immune system's job is to remove from the body that which does not belong in the body, let me ask you a question. Are there more things in our world today that don't belong in our body than there were 20, 30, 40 years ago? It's crazy how much more there is. So our immune systems today are working harder than ever in the history of humankind. So when the immune system have to work so hard, they start to make mistakes. and they start to lose tolerance to self, and they start to form these things called antibodies or immunoglobulins to your own tissue. So, however, there are well-known triggers to any autoimmune disease. These are well documented in the scientific literature. This stuff that I'm going to be going over with you today is no theory, it's real. You can look it up yourself. Identification and removal of these triggers can put an autoimmune disease into remission. And traditional medicine doesn't look at these triggers at all. I don't know why, but it's pharmaceutically driven. The gateway to autoimmune disease is a compromised gut barrier known as leaky gut. Listen, in order for something to get into the body, it's got to pass through a barrier system, right? So if I cut my skin, you all know that's going to increase my chance for infection. Why? Because I have a hole in my barrier. Now the outside world and the inside of my body, they're exposed to each other. If I took all my skin off and ironed it out, it might cover like an 8 by 10 room. If I took the lining of my gut, my small intestine, the one-cell lining with all its little grooves and folds, and ironed that out, it would cover 2 tennis courts. That's the biggest barrier between the outside world and the inside of our body. So when things are in our gut, in this tube that runs through us, they are technically on the outside of our body still. They got to get absorbed. That barrier system in the small bowel is like a screen door to your home. And if you got holes in your screen door to your home, things are going to get in, and you're the immune system trying to swat it and get it out, and you're knocking things over. You're busy trying, just fix the screen door. So leaky gut is the gateway, in fact, to autoimmune disease. In fact, a lot of research shows that you cannot even have an autoimmune disease if you don't have leaky gut first. So it's the first thing we always test for and fix in all of our autoimmune patients. So as I said, our immune system's working harder than ever today. There's so many more vaccines. There's pesticides, chemicals, plastics, hormones in the water and in our food, and antibiotics, things like that. So autoimmune disease is grossly underdiagnosed. They estimate that 1 out of 3 females will be autoimmune and 1 out of 5 males. Autoimmune disease are progressive, they're unless the triggers are removed. So where you're at today watching this video, you're going to be worse with time, okay? Like my dad, who's the plumber, right? He used to say, leaky faucets never get better. They only get worse unless they're fixed. So your white blood cells have lost tolerance to self, and they're mistakenly producing these antibodies or immunoglobulins to your own tissue. That leads to tissue destruction and malfunction of that tissue eventually. And all of this creates excessive inflammation throughout the body. These are the most common autoimmune diseases of the 80 or more that exist. Hashimoto's thyroiditis, that's the #1 in the United States. Graves, we see a lot of rheumatoid arthritis, multiple sclerosis, lupus, I've been seeing a lot more cases of that. We have one young lady, 32 years old, stage 4 kidney disease as a result of her lupus. She's close to needing, dialysis. And then Sjogren's we see a lot of, Crohn's disease, ulcerative colitis, the inflammatory bowel diseases, type 1 diabetes, myasthenia gravis, psoriasis, psoriatic arthritis, celiac disease, and brain autoimmunity. If you know you have an autoimmune condition, a lot of that autoimmunity too is going to start reacting in the brain. So mistakes, there's 2 types of mistakes our immune system can make. They are not doing what they should do. Those are errors of omission, like infections and cancer. Now, understand, folks, remember I said our immune system's job is to remove from the body that which doesn't belong in the body? Well, right away we think those are things from the outside coming in, right? And that's true, but every day in our body we have 50 to 80 billion cells that are becoming defective and they're dying. And the immune system's job is to remove those from the body, right? So if the immune system is not doing that, those cells replicate and grow. Those are tumors, whether benign or malignant. So there's a lot of studies that show people with autoimmunity, or if you are on immunosuppressants, which a lot of you are, your chances of cancer go up. I mean, just watch some of those commercials, right, for Humira and Enbrel. This may increase your risk of lymphomas and certain types of cancers. This is the reason why. You're suppressing your immune system. And I understand why you're doing it, and it does work, but at what cost? So errors of commission, where they're attacking our own tissue, attacking foods, which is food sensitivity or allergies, and attacking environmental things like mold and dust. Those are called allergies. So the traditional medicine answer to this is pharmaceutically driven, right? So we have the corticosteroids, prednisone, and all these different types of steroid drugs. Folks, I just read a study on prednisone. If you take prednisone for 10 days, your chance of osteoporosis go up 270% the rest of your life, right? If you take it for a year, which a lot of you are, your chances of developing osteoporosis go up 21,000%. You're almost for sure going to get it. It destroys tissue. It increases the risk of infection. It lowers thyroid function. It thins the bone like we just talked about. It breaks down the gut barrier, making your autoimmunity even worse, right? So it suppresses adrenal function, all these different side effects that you can see right here. And then there's the oral 5-aminosalicylates. These aren't used too often now, but look at the side effects to these medications. And then we have the so-called biologics, right? Really immunosuppressants like Imurin, Humira, Remicade, all these different methotrexate they use a lot for RA, for rheumatoid arthritis, and Enbrel. Folks, like I said, this is squashing your immune system, and that increases your chances of cancer and getting colds and flus, and it's not a good long-term strategy. Now, what we don't do is we don't tell patients, go off them, right? You got to keep taking them, but we're going to address the underlying causes that we're going to discuss in this video. Once we start eliminating and removing those causes, then you can gradually get off these medications, right? Without the side effects. So without it coming back. So, and again, the side effects of the biologics are infections and cancer. So what do all these have in common? They treat the symptoms, folks. They don't treat the underlying causes, okay? That's what we're going to talk about today. So one of the things I like to discuss is, have you been told that your lab tests are normal, right? And you don't feel normal? It's very frustrating. I see that all the time. People come in. Well, let me teach you about lab ranges, okay? When you go to a lab and they draw your blood and your doctor gets the results and they're comparing you to a range, and no one ever asks, well, how'd they come up with that range? Well, I'm going to teach you. They take the average low and the average high of whomever's been in that lab for the last year. Now think about this. What kind of people go to labs? Sick or healthy people? For the most part, it's sick people, right? So lab ranges are based on an unhealthy population. So when your doctor's looking at your results, your doctor is waiting for you to get sicker than the average sick person in the United States. And let me tell you, the United States is not a very healthy country. So we don't do that. We use what's called functional ranges. And let's go to the next slide. Functional ranges, what I mean by that is this. If you drew the blood of 1,000 healthy people, those are the ranges that we would use. And I didn't come up with those values. The American Academy of Chemists and the Endocrine Society did. They said it's silly to compare you to the average person that goes to a lab. Let me give you an example. Like TSH, you can see on the graph here, TSH is a thyroid stimulating hormone. It's a brain hormone that stimulates the thyroid. And the average high and low, roughly is between 0.3 and 5.7. So if you show up at 4.2, you can see to the right. If you show up at 4.2, what's your doctor going to say? Well, you're fine. Thyroid's fine, right? We know if you drew the blood of 1,000 healthy people, that range would fall between 1.8 and 3.0. What are we going to say? You got a problem. So functional ranges is the way to go, and that's where we can really sleuth out problems in people that their doctor says are normal. So here we go, the top 10 triggers to all autoimmune disease. Poor barrier system, we kind of alluded to already. Inflammatory diet. Poor detoxification system. This is huge. If you can't get rid of toxins out of the body, then your immune system is working overtime. Food sensitivities. The food we eat today is not the same food we ate 10, 20, 30 years ago. It's been genetically modified and deaminated and all these different chemical processes. Hidden infections. Poor thyroid function. Thyroid's a major player when it comes to immune function. So is your adrenal glands. Poor gut microbiome. I wish I would have put that at number 2. These aren't necessarily in order of importance, but the gut microbiome is a series of bacteria, trillions and trillions of bacteria that serve as part of our immunity, and certain nutritional deficiencies that a lot of you have, and genetic mutations will also drive autoimmunity. So poor barrier systems, let's look into this. Things that do not belong in the body are getting in the body too easily, and your immune system is overworked and trying to remove them. So our barrier systems are tonsils. How many of you had your tonsils removed? That was like a big thing. I'm 60, right? Back in the 60s and 70s, yeah, just take them out, right? So let me tell you, we're not built with spare parts. And our tonsils and adenoids are a huge part of there's a major lymphocytic activity there. It's a huge part of our immunity. So when you have your tonsils removed, that's a big strike right there. Poor saliva production, right? That's common, especially if you got Sjogren's. Low stomach acidity. You know, a lot of you are on like proton pump inhibitors, you know, Nexium, Prilosec, because you got acid reflux and heartburn. Let me teach you something about that. The stomach is meant to be super, super acidic. One of the things that the stomach, why it's acidic, is every time we eat, folks, there's microbes and germs and things in there and toxins that don't belong in our body, and the saliva and the stomach acidity gets rid of a lot of that. So a lot of you aren't producing enough acid. You're not producing enough acid. So when you eat, your food sits there too long because the acids are there to break it down. And when food sits there too long, you're going to get bloated after you eat. And the acids you do have reflux upward where they don't belong. So you have too much acid here because you got too little acid down here. And so you go to your doctor, what do they put you on? Acid reducers, right? It's deceptive because it gets rid of the symptoms, but it makes the problem worse, right? And then you get malabsorption, you get chronic gut infections, then you go on antibiotics, and it's maddening, right? And the cycle just keeps repeating. So many of patients that come to my clinic get the stool test, and we see, I don't ever remember an autoimmune patient that did not have something wrong growing in the gut. So low stomach acidity. Poor gut flora, which we talked about. Poor skin barrier, so acne, eczema, cuts, burns, psoriasis. But the worst of the poor barrier system is the gut. In the small intestine, we have this one cell layer with all these little folds that you can see in this drawing here. And when that becomes too permeable, it's like having holes in your screen door on a hot summer day. Things are making their way in, and it just causing chronic immune activation. And again, when you activate the immune system too much, it starts making mistakes, and it causes a flare-up of your autoimmunity. So we measure for this in a specific test, and there's three different types of leaky gut syndrome, and it can be so easily fixed. This is the first thing that we do and correct in all of our autoimmune patients. There's an old saying, okay, and it goes like this. If you find yourself in a hole, the first thing you got to do is stop digging. So when we see patients with leaky gut, then your immune system is constantly being assaulted by all these microbes and large particles of food. We got to fix that. We got to fix the screen door. Number two, okay, so leaky gut, number one. Number two, or compromised a barrier system, I should say. Leaky gut's the most popular one. An inflammatory diet. So folks, if your blood sugar is too high or too low, right, you're getting insulin surges, and insulin's very inflammatory. So blood sugar, poor fats. So many of you are eating hydrogenated oils, trans fats, you know, like vegetable oils, canola, soybean. They're ubiquitous. They're in all these packaged foods. That causes systemic inflammation, and that drives your immune system crazy. Alcohol, tobacco, caffeine, high histamine foods, high lectin foods. Lectin are proteins that are part of our plant's immune system. And so like tobacco, tomatoes and peppers and things like that, that can stoke the immune system too. And FODMAPs are certain short-chain sugars that your body can't process. Some people have problems processing it. That creates inflammation. So on the blood work, we're going to see all these inflammatory markers like glucose, and we're going to know right away that this person is inflamed. So we'd have to fix blood sugar on that patient. So here we see liver enzymes are high. These are inflammatory markers too. Iron is an inflammatory marker. So this is how we know the patient's inflamed. And we're going to know from the history too. They're like, I'm bloated. I walk and my ankles swell. I got joint pain. I got brain fog. All these are markers of inflammation. And these are some more markers of inflammation that we'd see on the blood work. Here's a patient right now. This is Kelly, actually. I remember Kelly. She's a nurse, and you know, sometimes, nurses are very like traditional medical oriented people, right? And she brought her husband in who had like an immune system problem, worked on a farm, and she was very skeptical with what we did, but I helped one of their friends, and so she brought him in, and he did great. And then she came to me, right? And now she's one of my, she loves, we've developed into a friendship. So look at her face right here. This is an inflamed face. Here's Kelly about 4 months later. You could see that isn't fat that she lost, that's inflammation, folks. So her face was very inflamed once we identified all the inflammatory markers. Number 3, poor detoxification. So here we go. We got these different things in our body that will eliminate toxins. We're all, we live in a sea of toxins, okay? Sometimes we can't help what gets in us. Many times we can. So we have to look, if you're not detoxifying these chemicals or these things that are making their way into the body, then your immune system has to deal with them, right? So if you detox better, then the immune system, you're taking a load off the immune system. So liver, we all know the liver is all about detoxification. We got to look at the liver. So is the gallbladder. So those of you who are listening to this and you don't have a gallbladder, you need to be taking bile salts, okay? That's going to be your new gallbladder. And don't let them convince you that you don't need a gallbladder. Trust me, you need a gallbladder. It's a huge part of eliminating fat-soluble toxins. Because they produce bile salts, and bile salts emulsify our fat-soluble toxins, one of which is our used-up hormones that need to get out of the body. And so if you can't eliminate these hormones, they get reabsorbed right back into the system. So those of you who are listening to this and have hormone dysregulation, that's a huge problem. We see that all the time. Kidney function. We have so many people that come in, don't even know it, they're in stage 2, stage 2A or 3 chronic kidney disease. That's another way we get rid of toxins. Low exercise. Folks, we're built to move. Okay, we got to sweat. We got to move. That's breathing gets rid of. There's 4 ways we get rid of toxins, okay? We defecate, we poop them out, right? We urinate them out, we sweat them out, and we breathe them out. That's why things like saunas and things like that are good. You sweat to get rid of them. If you are having a lot of night sweats, one of the causes of that is you're so toxic, it's trying to get rid of those toxins through your sweat. So we always recommend at least 20 minutes of exercise per day, and the heart rate should be 180 minus your age. And it's not too difficult, it's just you're breathing a little hard, and that's a great way to remove toxins from the body. Poor sleep, because that's when we eliminate a lot of our toxins, and poor lung function, because we're not breathing, right? Most people don't breathe deep enough. It's one of the things we go over in our programs. So these would be another, these are liver markers right here, liver enzymes that are elevated. So we know this person, their liver is struggling. We got to find out why. And a lot of times it could be due to gut dysfunction, but there's so many different ways the liver can be struggling. We have to identify that so that they're removing toxins better, and that helps their autoimmune disease. All right, number 4 is a big one, food sensitivities. As I mentioned, the food we eat today is so different due to genetically modified. I mean, Monsanto they did it to make money. They processed these seeds and they changed them genetically so that microbes or bugs don't eat it, right? So they save money. But when you change something chemically and you eat it, and our immune system, which 80% of our immune system's in our digestive tract, they see this and they're like, that's not the same corn or rice or whatever that grandma and grandpa ate. And so they're going to attack it. This is foreign, right? So, and it takes generations for our immune systems to get used to a change. So those of you who are my age, you might remember the commercial, it's not nice to fool Mother Nature, right? So anyhow, chemical additives and deamination of wheat has caused the gluten molecule in wheat to be very, very different, and so many people react to that. Here on our patients, we do a finger prick test that we send you the kit to your home, or if you live close by, we give it to you in person. And it's a food sensitivity test. So very important, folks, that you understand there's a lot of bad food sensitivity tests out there. They only check for one antibody, immunoglobulin G, it's called. And we do both, IgG and IgA. Those are two. Immunoglobulins and antibodies is the same thing. It's like saying couch or sofa. It's the same thing. So we check for both of those antibodies, IgG and IgA, and that's important. And you can see on the left two columns, this person reacts. When this person eats those foods, it's 96 foods we check for. When they eat those foods, they react to it. They have an immunological response to it, and that's going to cause a flare of their autoimmunity. So they need to get off these foods for a while until we fix leaky gut, and most of them we can add back in. The ones on the right are good. So just knowing this is a huge step toward putting your autoimmunity into remission. And then here, this is the actual gluten test that we do. Folks, there's actually 12 different parts to the gluten molecule, and traditional medicine looks at one of them, and if you don't react to that one, they say, oh, you can go ahead and eat gluten. But I'm telling you, the science says otherwise. If you react to any of those 12, you should not be eating gluten. So, and going gluten-free these days is so much easier than it used to be when I first started doing this. It was really hard. It's just so much easier right now because there's a need for it, right? So many people have it. Number 5, hidden infections. Dental infections. I have 2 daughters that are dental hygienists. They go, yay, Dad, keep teaching that. So you should take care of your gums, take care of your teeth, floss every day. See your hygienist and your dentist twice a year. They've done all kinds of studies that if you get your teeth regularly clean, you live 6 years longer because you have less inflammation, because there's a huge source of microbes right there. Gut infections and overgrowth, folks, are ubiquitous. Like I said, I can't remember an autoimmune patient that didn't have overgrowth or infections in their gut. And then other viruses like cytomegalovirus, Epstein-Barr virus, herpes simplex virus, or hepatitis C we see a lot of. Those are chronic infections that will just cause your immune system to be smoldering all the time, and you can never get your autoimmunity into remission if you got them. And there's so many natural ways of getting rid of it. Same thing with Lyme. We had Borrelia burgdorferi and its co-infections, Babesia and so on. This is very, very common. It doesn't just happen in certain areas, and it's not just deer ticks that can transfer it. All the studies show that. So we see a lot of Lyme, which is a bacterial infection. So here we see on a stool, we do a DNA stool test. It's a wonderful test. There's no false negatives, no false positives. We're looking at DNA of all the normal microbiota and also ones that don't belong down there. So you can see this patient right here had 3 different bacterial infections and 1 viral infection. And she was autoimmune. So we were able to use things, natural antimicrobials, to get rid of these infections without damaging her, the good guys, right? That's why these things work so much better than antibiotics. So here's a patient right here who came to me with Lyme disease, for example, and she had it for like 12 years. I mean, her life, she literally told me she wanted to die, right? I helped one of her friends, and she emailed me, and she said, please, I hope you can help me. She took all these different antibiotics and medications, you know, all of that, all FDA approved, and she was getting nowhere, just getting sicker and sicker. She had so many different things wrong with her that we found out on the testing that we do why she could not get rid of the Lyme disease. And she also had autoimmunity against her thyroid. So check out her picture 4 months later. This is her picture 4 months later. Go back to the previous slide. Look at that, and then look at 4 months later. That's amazing, isn't it? That's what happens when you look at the true underlying causes. And she had been suffering 12 years. So when I give these, when I do these videos, I get like worked up and I get excited because I know you're watching this, you're suffering. You're not enjoying this life. We got one trip around this thing we call life. And every day is precious to us. And it bothers me that so many of you don't know about this stuff and you have access to it. If you don't come talk to me, talk to someone else that does it. But don't live your life according to the medical model when you've got this autoimmune stuff, and especially if you're really suffering. Okay, poor thyroid function. So now we could spend an hour and 17 minutes talking about the thyroid, and there's 22 ways the thyroid can go wrong. Your doctor looks at one of them. The medical approach to thyroid is woefully inept. So if you got a thyroid issue, watch my hour-long video. Actually, it's an hour and 17 minutes. That's why I said that. And learn about those different ways, because thyroid is a major, major, major part of our immune system. It regulates our immunity. So here we see on the blood test that this person has autoimmunity against the thyroid, which is called Hashimoto's. You could see the positive antibodies at the bottom there. And then her production of the actual hormones is very low. So number seven, poor adrenal function. So the adrenals make a hormone called cortisol. Just like cortisone or prednisone and all these corticosteroids really suppress the immune system, well, we have a natural cortisone, so to speak, called cortisol. It's a major immune modulator. It keeps the immune system working well. And so we look at that hormone very closely. And when that hormone is off, your immunity is not going to work very well. But then we got to look at, well, why are the adrenal glands not working very well? Not just give you, artificial stuff. We want to fix the adrenals and why they're not working. Anemia. So the adrenals are stress glands. Folks, when you're anemic, and again, we use functional ranges, not lab ranges, right? When you're anemic, you're operating on low oxygen. The most stressed out situation you can be in is when you don't have oxygen, right? Because you're walking around with 20% deficiency in oxygen because you don't have enough red blood cells to carry it. That's extremely stressful. And so your adrenal glands are going to eventually poop out on you. Poor blood sugar, too, is a big stressor to the adrenals. Poor sleep. If you're not sleeping very well, that's, game's off. You're never going to be healthy without proper sleep. You got to get at least 7 hours of sleep a night, uninterrupted. Inflammation is an adrenal stressor. Low progesterone in females and low testosterone in males will disrupt cortisol and the adrenal function. And certain B vitamins, vitamin C deficiencies too. I mean, there's so many different things that can affect the adrenals. Here's our adrenal test that we do, our adrenal stress test. This is a saliva test, so we measure, because cortisol should be high in the morning and then decrease throughout the day, right? And then there's another hormone that does the opposite. So cortisol high in the morning, the other hormone is called melatonin. So as cortisol goes down, melatonin goes up, right? And melatonin, as most of you know, is about sleep. So if the cortisol rhythm is off, melatonin is going to be off, so you're going to have sleep problems. And so here we see it's a saliva test. We want to check out that rhythm, so we have the patient, we collect the saliva when they first get up, around noon, around 5, and right before they go to bed, because we want to look at that cortisol rhythm. And the blue line is the patient. You can see the 4 blue dots. That's the collection time. And the green line is where we want the patient to be. That's optimal levels. And you can see this patient has very low cortisol, and that was triggering her autoimmunity. Then we had to go about, figuring out, well, why is the adrenal glands not producing enough cortisol? And then we see here low progesterone also will do it in females. And so this is also part of the saliva test. Okay, number 8. So, and we're going over the top 10, folks, but I'm telling you, there's a lot more than 10. These are the ones that are like the biggies. So, poor gut microbiome. All right, let me give you my South Side of Chicago definition of the microbiome. We have living on us and in us trillions and trillions of bacteria that do some very, very important things for us. And we do nice things for them. We give them a nice home to live in. So 80%, and that's called our microbiome, small living system. So 80% of that lives in the digestive tract, okay? That's where 80% of our immunity is. So we always fix the gut first in an autoimmune patient. So the gut microbiome is that 80%. Now I'm going to teach you something. The other 20% is on our skin and our upper respiratory tract, sinuses and things like that, and our lower general urinary tract, especially in females. When this microbiome gets disrupted, as we see all the time, the other 20% can get disrupted too. So, and we see this a lot. So a lot of people are walking around with skin issues like rashes and eczema and psoriasis, or they got sinus issues and and they're always coughing up, sputum, or they got chronic urinary tract infections and yeast overgrowth, especially in females, when this is the cause. Once you fix the epicenter of your microbiome, which is your gut microbiome, the other 20% fall in line. I can't tell you how many patients have come to me, chronic urinary tract infections and chronic sinusitis, and they're even going for surgeries for this. They're chronic antibiotics, which is destroying even the gut microbiome even more. So one of the biggest reasons of a poor gut microbiome is poor stomach acid production. And like I mentioned, people, you need to understand, acid reflux is almost always due to low stomach acidity. I'm going to repeat, low stomach acidity causes the food to sit there too long because it doesn't break it down. And then the acids you do have get pressured, they push upward. So you have too much here because you got too little down here. And the paradox is that you go to your doctor and they put you on acid reducers, which, like I said, is deceptive because it helps with the symptoms here, but it's making the pH of your stomach and the rest of your intestines bad. And if any of you own a pool, pH bad in the pool, you're going to get things overgrowing that you don't want. So that's the number one cause. Another one is poor brain-gut connection, and we talk about that, where the vagus nerve from the lower part of the brainstem stimulates acid production. Another one is low thyroid, right? So anyhow, what these microbes do in our digestive tract, I mean, they do a lot of things that I'm not going to get into all of them, but when it comes to autoimmunity, they produce these things called short-chain fatty acids. And these short-chain fatty acids are immune modulators. They've done there's a ton of research behind this stuff. You can Google it and look at it. Another reason for poor gut microbiome is poor motility. You know, I have patients coming in, I'll ask them, Mrs. Jones, do you have regular bowel movements? Oh yeah, Dr. Beyer, I have one once a week. And I'm like, once a week? That's not regular, Mrs. Jones, okay? You should be going number 2, okay, twice a day, at least once a day, right? And it should take you as long to go number 2 as it does to go number 1, all right? You could tell I have 5 kids. All right, next slide. So this is the DNA test that we do. We send the kit to the patient. They collect the sample with instructions, and then we give you a FedEx to send it to the lab. And you can see they have overgrowth of autoimmune. They've been able to, in the science now, they know, like, for example, if Klebsiella is overgrowing, that relates to Hashimoto's, okay? It's called molecular mimicry. So Klebsiella is a bacteria that normally resides in the digestive tract, but when it's overgrown, the immune system is going to form antibodies to try to get it down, right? And so now Klebsiella looks a little bit like this enzyme in our thyroid. So when they start to attack that Klebsiella, they're going, there's this enzyme in the thyroid that looks a little bit like Klebsiella, and it starts to form antibodies to it. It's called molecular mimicry. Pretty cool stuff that they're discovering. And Provitella relates to rheumatoid arthritis. There's some that relate to Crohn's and ulcerative colitis. So it's really, really neat stuff. This is a DNA test. So it's just a wonderful test. There's no false negatives, no false positives. If the DNA shows up high, it's high. So we're able to use natural things like berberine and grapefruit seed extract and things like that to lower this. And then we can retest and make sure that it's gone. And then we see candida on that too. Here's a yeast overgrowth. Here's a patient, Kermit was his name, wonderful man. I think he drove like 3 hours to see me. I'm like, Kermit, we could do this online if you want. Oh, no. He wasn't into that. So he would drive 3 hours for his visits. He had, you could see the psoriasis, really, really bad skin. He had tried Stelara and Otezla for years, all these different things. He had parasites in his gut. He had poor cortisol responses, just a ton of different triggers. Now look at his picture 6 months later. Look at that. And he lost 70 pounds too, right? Because I'm telling you, when the gut microbiome is off, you're never going to be able to lose weight. That's a really big reason for obesity, not just, I'm going to go off into a tangent. Obesity, folks, is not just about calories in and calories out. There are certain metabolic issues that will make you prone to obesity, and gut microbiome is one of them. So here, I think we got another picture. Let's do the next one. Look at the eczema plaques on his leg. Now, this is after years of trying different medications. Now, once we found out the triggers and removed them, that's in remission. Now, if he goes back to doing, like he had food sensitivities, I guarantee you, if he starts eating some of those foods that he reacts to, those plaques are going to come back. But you see, at least he knows, right? And he knows to avoid it. And he actually was a really good patient. He wouldn't do that. Then there's genetic mutations, okay? So there's a process called methylation in the body, and I don't want to get too technical, but It moves methyl groups from one part of the molecule to the next, or it adds it to the molecule, or it takes it off. That's called methylation. And methylation is that process of moving these parts of a molecule around require what's called methyl donors. And methyl donors, three big ones are B6, B9, and B12. And many people aren't able to make the proper form of B6, B9, B12 because they have genetic mutations that don't allow that to happen. A lot of you know about MTHFR. There's like 6 other ones. So we do a cheek swab test to look at that. And once people have that, and so many do, we can circumvent that through proper use of nutraceuticals. And methylation is important because methylation turns the bad genes off, the genes like when we become autoimmune, and it turns the good genes on. So by way of thyroid function. And vitamin D, most of you know vitamin D is a huge immune modulator. And so when you're low in vitamin D, and so many of you are because you're not absorbing it, you don't have good gallbladder function, you need bile salts to do that. We always use an emulsified form of vitamin D. If you're autoimmune, your vitamin D should be between 80 and 100, both forms, okay? Most doctors don't check for both forms. So vitamin D, there's certain genetic mutations that will stop you, the VDR it's called. If you have that mutation, then you don't absorb your vitamin D very well. So you have to take extra amounts, right? And folks, don't be taking 50,000 IUs of vitamin D all at once. It's ridiculous. Doctors prescribe that. You can't absorb 50,000 IUs of vitamin D all at once. It's like asking you to eat, a 20-pound steak. You can do it over the course of a couple of weeks, but not in one sitting, okay? So mitochondria function, and mitochondria are the organelles in our cells that make energy, and they also regulate the immune system. So there are certain genetic mutations where the mitochondria are not working properly. And we can work around that by taking CoQ10 and magnesium and things like that. But at least we know and we can work around these mutations so that we can get the immune system working properly. So here's the sample report that we use. The ones in yellow and red are positive and ones in white are not. Now, you can have a mutation. It doesn't mean that you're expressing it. So, you can have a gun with bullets. It doesn't mean you have to shoot it, right? So the genetics, the way that we're built is pretty miraculous. There's redundancy in our genes. So you don't always express these mutations. We have to look and compare them to other lab markers to make the correlation, whether it's being expressed or not. And here's another report for mitochondria. Number 10, we're at number 10 already, okay? So nutritional deficiencies, vitamin A and D are major. These are fat-soluble vitamins. We have 13 vitamins. 8 of them are B vitamins, and then there's vitamin C. Those are all water-soluble. And we have 4 fat-soluble, A, D, E, and K. And those require proper gallbladder function to be absorbed. And so many of you aren't getting the adequate amounts of vitamin A and D. We always mix a little vitamin K with our D because especially if you have that VDR mutation, it helps the D to get transported. Vitamin A and D are immune modulators. They're like the generals. They help the regulatory T lymphocytes or our Th3 cells in our immune system to work properly. And so those are important. Essential fatty acids also modulate those regulatory T lymphocytes, and so does glutathione. So a lot of you have heard of glutathione. Glutathione is your friend if you're an autoimmune patient. Glutathione, not only is it an immune modulator, but it's the most powerful antioxidant that we can take to counteract free radicals. So all of these are necessary for immune modulation, and the causes for these deficiencies are poor diet, malabsorption, we already talked about this, and genetic mutations. So to recap, due to the nature of our world today, autoimmune disease skyrocketing. And the underlying cause of autoimmune disease is multifactorial, okay? What I mean by that is it's never just one thing. And I know a lot of you are going online and you're trying to guess at this, and I don't blame you because your doctor's not giving you things, but you don't know which factors you have until you do this testing. That's why I implore you, consult with me, and we're gonna go over that in a little bit, or go to someone like me, right, that really knows this stuff. There's always more than one. I would say my average autoimmune patient has 6 to 8 significant triggers. And once you eliminate them, you're able to put that into remission. And then you have that information the rest of your life. So proper testing and management is crucial. Traditional medicine has little to offer and sometimes very serious side effects, like cancer, okay? Once you have one autoimmune disease, your whole body's on the menu for an attack. Once those genes start flipping on, you're gonna have multiple autoimmune diseases. It's just really true. So to be honest with you, and I wanna know what autoimmune diseases you have, but I'm more concerned with why you have them, okay? Because if you're autoimmune against your thyroid and you're autoimmune against the cerebellum and brain, what's triggering that is the same. So we just look for what's causing it and get rid of it. So all autoimmune disease impacts brain function. The 6 tests that you should really, really get, you got to do very, very comprehensive blood work. Again, we use LabCorp. And when you go to LabCorp, man, it's like they draw 8 tubes of blood, right? The local one near my clinic in Tinley Park, Illinois, they know me there. They're like, crazy Dr. Beyer, and he draws all this blood, but he gets his patients better. I got like a little reputation there. And like, for example, we're gonna look at 9 thyroid markers just on the blood work. And we're gonna compare you to functional ranges, not lab ranges. Food sensitivity test, that's the finger prick test that you do at home. You send it to the lab, to 96 different foods. And then we check for leaky gut testing, that's also a finger prick. Genetic testing is cheek swab. DNA stool testing, again, is a kit that we mail to you, or if you live close by, we give it to you in the clinic with instructions. And then you mail it to the lab. And proper hormone we do through saliva. So, the fatigue is like the biggest complaint that we hear with people that have these autoimmune diseases. And, I like to define the word metabolism as converting the food that we eat into energy, food to energy, right? So metabolic problems then mean that you're not converting your food to energy, so you're fatiguing. Now, the organ that requires the most energy is the brain. Brain weighs 2% of our body weight and consumes 30% of our energy. So guess what? If we got these metabolic problems, guess which organ suffers the most? The brain. So you start to get neurological symptoms. And these neurological symptoms can fall into 5 categories. Right there. So abnormal sensations, like common one is you're losing hearing or ringing in the ear or cold hands, cold feet, or numbness, tingling, that kind of stuff. Abnormal movement, like you become more clumsy, bumping into walls and tripping, or your gut doesn't move right, or muscle fasciculations or tremors and things like that. Abnormal autonomics. Now, the autonomic nervous system portion of the brain is the part of the brain that controls bodily function automatically. So we start to see things like dry eyes, dry mouths, sleep apnea, heart palpitations, increased blood pressure, low blood pressure, poor digestion, poor hormones, frequent urination. All these bodily temperature regulation is bad. So all these bodily functions start to go that run automatically. Abnormal cognition, so thinking, so you start to get depressed, brain fog, anxiety, lack of motivation. You can't focus on things. You don't want to do things anymore. You just lose that motivation. And abnormal posture, chronic neck pain, back pain, and things like that. So now we're going to share with you a couple testimonials of actual patients that have come to our clinic. They probably watched one of my videos like this, and they came in for a consultation, and they decided to go through with it. So enjoy.
Hello, my name is Cheryl Andrews. I am 52 years old. I found Dr. Beyer almost like being touched by an angel. I was having a procedure at the hospital for having issues with swallowing, and the nurse there just touched my arm and said, "You need to see Dr. Beyer. He will help you." That was after I was telling her all my medical issues. I had severe thyroid problems. I had gained 80 pounds. Losing my hair, alopecia, which they told me it's an autoimmune disease, nothing can happen. They couldn't do anything for my hair. So I was just slowly deteriorating and no energy, no will to even do anything. I am with him 5 months. I've lost 52 pounds. My hair, as you can see, has grown back, which has been tremendous boost to just self-esteem. I am thankful that I found Dr. Beyer because he has given me my life back.
I had 7 years earlier, I had a flare-up with that was diagnosed with Crohn's, and And I had a fistula with that as well, so I was taking medication for that and to keep the fistula closed. Also having lots of problems with heartburn and digestive issues, particularly at nighttime, that would disrupt my sleep, and taking medicine for that. And I was at a point where I just didn't feel good. You know, I was sick and tired of being sick and tired. I had no energy, I had brain fog. And I felt like I couldn't lose weight, and I would gain more weight, and it was cyclical, and I just felt worse and worse, and so I knew I had to do something. And so when I came here, I was looking for answers, doing something that was going to make me feel better and get my energy back. I was totally committed to it, and I did it, and I started feeling better almost immediately. And so within probably a month of being on the program, my GI doctor encouraged me to go off the Dexalant that was for the stomach issues. He said go off of it cold turkey. So went off of it cold turkey, and I was really nervous because historically if I would miss a pill, I would feel terrible. But I think I had been doing the program with the Repairavite and the supplements, that they were really helping me so that I never had problems when I went off that medication, and I didn't have any issues with it. And so, just kind of continued with that program, and it made me feel great. And I've lost 50 pounds. I feel good. I have lots of energy.
That's what I hear, yes.
I feel wonderful, and I feel like this saved my life.
Oh, that was terrible. I just had constant bloating, constantly in the bathroom. I would be upset all the time. It was just horrible. The doctors I would go for tests all the time. I would be in the hospital constantly. They would constantly take bowel out and then just give me more medication.
You've had surgeries.
I've had 3 surgeries. Oh, I suffer from depression after my baby. I also had thyroid problems. I've had all kinds of different things. Yes.
Okay. And how long have you been under our care here in our clinic?
What's it, 8 weeks?
8 weeks?
10 weeks?
Okay. Tell us how your symptoms are now compared to...
Oh my God, my symptoms are minimal. I have minimal pain. My mood is unbelievable. I have so much mental clarity. I'm not forgetting. I'm not crying. I would cry every day. I don't remember last time I cried. Today was the first time I cried, and it was because of happiness. I was just overjoyed.
Why were you overjoyed today?
I was overjoyed because last week I had a CT done. I had
of your bowel.
Of my bowel. Mm-hmm. Yeah, my abdomen and my pelvis. And they had told me that I had high resolution, so they were able to see that I didn't have barely any inflammation. Mm-hmm. And I also had a cyst on my ovary, which probably, I don't know what that did, but that's also shrunk. It was like 4 centimeters, now it's about 1.5 centimeters.
So the doctors were pretty surprised?
Yes, they were shocked. They couldn't believe it, because probably in about the last 10 years, I have not had a clean CT, even after surgery. I haven't had like a CT that's come back that has been that good.
For 10 years, the first time?
Mm-hmm. Oh,
but
gosh.
we found, number one, we found some sensitivities to food, correct?
Right, and I also had the Hashimoto's. You found that, you diagnosed that, which my doctors missed.
Okay, so Hashimoto's is a thyroid problem.
Right.
Okay.
Mm-hmm.
So we addressed that, the autoimmune condition.
I can't tell you the difference. And just even my energy. It's just unbelievable.
We're just getting started, too.
I know.
8 weeks, you feel...
Oh, my gosh.
Big difference. Life-changing?
Oh, my gosh, yeah. It is so worth it, only because of the amount of money I'm going to save by not going to the hospital every year, number one, because I think I spend a ton of money on that. And then also, just the way that I feel. I just cannot believe it.
Totally worth it,
yeah. And the things that you think about when... you're making that decision, it's like, can you do it? Can you actually do it? And if I could do this, I was like the drive-through queen. Anybody can do that.
When I first came to Dr. Beyer, the reason I came to him, I was very frustrated with my fatigue, my inability to lose weight, my constant struggle in dealing with my newly diagnosed Hashimoto's. My hairdresser actually referred me to Dr. Beyer after I complimented her on how wonderful she looked. So she extolled, this great find here in Tinley Park, close by. I felt great. I felt like I've landed in the right place, that my issues were really heard, and they were going to be resolved. The pounds came off. Most importantly, my inflammation has decreased. I no longer have any joint aches and pains. I feel like slowly I'm reclaiming my life and being able to really participate 100%. So I highly recommend it. I am astounded at how wonderful I feel. It's life-changing.
I started coming to Dr. Beyer about a year ago, and when I first came to him, I had all kinds of issues. I had my problems with my stomach, I had anxiety, I couldn't sleep, I pretty much couldn't function at all. But he reassured me that he was going to get me better, and I wasn't really totally on board with it because I was afraid. I didn't know what this was all about, and here I am a year later, and I feel great. I sleep, I'm able to eat better, I exercise, I have energy. It was just great. I'm so glad I found Dr. Beyer, and the way that I found him was a friend of mine was on Facebook, social media, and there he was, and I called her and I said, "Is this for real?" And she's like, "Yeah, I've been seeing him, go see him, go talk to him," and sure enough, he works.
Autoimmune condition called birdshot chorioretinopathy, and it's a inflammation of the retina. Found out it was a gene I carry, but it came back in 2016, and I have not been able to get rid of it. Cannot believe the difference in how I feel. My energy level, my eyesight has improved. I've been treated for 3 months now, and the last 2 visits with my doctor have been an improvement.
Yep.
I was having burning in my eyes. I could actually see the inflammation in my eyes. I no longer have that. I don't have it in the rest of my body any longer. I don't have the aches and pains that I had before. I am much more energetic than what I have been in probably a year. So I can't believe the difference since I've been treated by Dr. Beyer.
Okay, so what's next? If this makes sense, I want you to call that number, 708-614-1222. They're answered 24/7, and schedule a 30-minute consultation with me, okay? 708-614-1222, and we're going to do a comprehensive consultation to determine if you are a good candidate for what we do. We charge $75 to reserve your time. Yeah, Dr. Beyer, I thought you said it's for free. It is. We're going to charge you $75 to reserve your time. By the way, my normal fee is $450, but people who have watched this video in its entirety, I don't have to go through all this when you come in. So we've already kind of done, you've done your homework. So $75, but if you keep your appointment date and time, or you don't cancel within 24 hours, I'm going to refund the $75 back to you. I got to do that because if I don't have people reserve their time, I call and I get their voicemail, "Oh, I forgot," that kind of stuff, okay? So, because my time, just like yours, is very important. We accept all credit cards over the phone, or you come in too. So you will be sent via email all the necessary paperwork. Please fill that out prior to our consultation. Not like an hour before, maybe, I don't know, at least a couple hours, because I want to look at that, and it's going to allow us to make best use of our time together. So, and we also, obviously, if you live close to the clinic in Tinley Park, we can do face-to-face consultations. Folks, this is an opportunity for you to sit down with someone that really cares and knows this stuff, and I'll tell you what the best plan of action is. And in a little bit, I'm going to go over cost of this too. So the purpose of the consultation, we're going to have an open and honest discussion of your chronic health issues. We're going to do a comprehensive history based on your paperwork and the discussions that we're going to have, Skype, phone, or in person. And I want to know your top 5 concerns, right? Because I want to work with you. I want to say, what are your goals too? How is this affecting your life? And what have you done? What medications are you on? What supplements are you on and have tried, and did it work? Right? And, what has helped and what hasn't. So what are your goals and what are complicating factors, which are usually things like sleep, abnormal work schedule, you work one time, third shift and then first shift and all of that, or bad relationships and things like that, childhood trauma. These are all, there's a theory behind autoimmunity that, it's a theory, and I don't dismiss it, that when people self-deprecate, when they don't like who they are, whether that's the way they were raised, then maybe your immune system won't like you either, right? To me, kind of, you can't separate those two. So are you a good candidate? Based on your history, I'm gonna know, how long we need to work together. Typically, I work with patients 6 months, sometimes up to 9 months, and we have a consultation, Skype, phone, in office, every 2 weeks. However, okay, this is important. My patients have unlimited email access to me. And I encourage them strongly, if you have a question, this doesn't feel right, or something happened, you email me, because we want to make course corrections sooner rather than later. Don't wait the 2 weeks to talk to me or email me. So I spend a good majority of my day just answering emails. So I want to know, are you willing? Are you a good candidate? Okay. So number one, are you willing to make the lifestyle changes, folks? If you're not, because I get people coming to me and they're like, I ain't going to change anything, it'll get me better, or I'm not going to stop, this, and I'm like, don't come see me if you're that way, okay? Because it's going to waste your time and your money and my time, right? So just, I'm looking for people who are like, I am so sick and tired of being sick and tired, and if it's going to work, I'm in. Now, here's the thing. A lot of you are watching this and you're saying, wow, this makes sense, but how do I know if it's going to work for me? And I'm like, you can't know. We haven't done anything yet. The only thing that qualifies you to call the number and consult with me is that this needs to make sense. And you've got to be willing to make some changes in life. Because if nothing changes, right? So you just don't know what to change, what to do. That's what people hire me for. The key isn't in testing, and someone who cares and knows how to get you through all these different things in a logical order, logical fashion. Another thing is if your spouse or significant other is not on board, not supportive, I've just learned that those aren't good patients, right? It's too much conflict, and especially with the dietary changes and everything. So what I always recommend is have them, him or her, watch my video or have them talk to me, right? And see what this is all about, because I think I'm pretty logical in how I explain this. Hopefully I have been. So, and the other thing is I can't get everybody better, right? I mean, I've had some cases of MS that were so progressed, and I'm like, I'm sorry, maybe it might make it from getting worse, but, so I'm very upfront and honest with people on this. And then there's a financial consideration, which we're going to discuss. So then what we do at the first consultation, if I feel you're a good fit and you think you are too, we're going to schedule a second consultation immediately, soon. All right. But that gives me a day or whatever to have time to determine, hey, what testing do I specifically need to do in your case? So that kind of, I want time to think about it. And then how long do we need to work together? Typically it's 6 months, sometimes up to 9 months. So also we're going to discuss all the recommended testing at that second consultation and length of care, right? And then the exact cost, and that's when payments. That's when we collect the money for your care. So the cost of care, I'm going to give you these fees. They are approximations and may vary slightly depending upon your specific plan. But we use a company called Care Credit to finance it. And I'm going to go through the 7 options that Care Credit offers. Some people just pay it all up front, and we give them a $500 discount. So now with Care Credit, this can be done. We can get you approved in our office only if you are physically there, right? Many of you that are watching this, that's not possible. I have patients sometimes, like I have one from Las Vegas. She goes, no, I really want to come meet you. I want to come see you. They flew in. I'm like, all right, if you want to, fly in, but that's not really necessary. So, but if you're long distance, our staff can guide you through the application process at home. It takes like 10 minutes. So here we go. Interest-free, these are approximations. 6 months, the payment would be about $1,100 for 6 months, interest-free. 12 months, interest-free, it's gonna be half that, $560. And then 18 months, interest-free, it'd be $375. Folks, $375, that's like not even a car payment to get your life back, right? And that includes, folks, all the testing, all my time and everything. 24 months at 14.9% is $325. 36 months at 15.9 is $240. 16.9 at 48 months is $195, and you can get it as low as $170. You can always start out long and pay it off sooner to avoid a lot of the interest. Let me tell you from the bottom of my heart, there's no obligation to begin care at these 2 consultations. If you just want to talk to me and all that, that's fine. I'm cool with that, okay? So I don't push. This is just, hey, that's why I'm just transparent about this. This is what it costs. But to get your life back, it's an investment in your health. To me, my health, I'm 60 years old, it's priceless. It's priceless. I have 5 children, no grandkids yet, but you know, I want to have a nice life, right? So these programs that I do, these are for people who are sick and they really want to start enjoying life. So recommendations, have your spouse or significant other watch my video or attend one of my webinars that I do live, okay? We stream them. This needs to make sense to you folks. The consultation is not this. It's me trying to convince you that stuff is real. That's not what the consultation's about. If you don't have that feeling right now that that doesn't make sense, then you're not a good candidate to consult with me, okay? But if it makes sense, what have you got to lose, right? So, and be serious about your health and your illness. You gotta be serious about it. I want people that are committed. I mean, no one does my program 100% because, how dare us be human, right? So if they do 80% of it, it's amazing the results that you can get. And finally, you're going to get real answers and understanding the causes of your autoimmune condition, folks. Real answers from testing, not guessing. There's a lot of functional medicine docs that do supplements and different things. They're guessing too. You guys could do that online, right? So it's the testing and then having someone guide you through that maze that we got to guide you through to get this thing into remission. I'm all about education because to me, this is a lifelong life-changing proposition program. And the reason why I like to educate, it's 3 reasons. Number 1, validation, because a lot of you are like, what is causing this? What's driving us? I get, patients all the time when we do the Skype or in-person seminars, and I go over their blood work with them, and I start talking about all these different things, and it makes sense to them. They start crying. They start weeping, or they get emotional because they like for once, someone is explaining why I have what I have. So that's called validation. Number 2, we're human, right? We have our weaknesses. To make it through the lifestyle changes in the beginning, you need to understand the why behind it instead of just, telling you, just do it, right? No, you're gonna know the why. I can give out handouts. You have a big binder of information that I give, it's on a thumb drive. I want you learning. And the biggest reason why I like to educate is number 3, you're going to have tools for the rest of your life, especially the autoimmune patient. You are going to know what triggers it and what doesn't. And so then you will have that information the rest of your life. And a lot of you, because there's genetics involved in this, you have children or whatever, grandchildren that suffer with it too. You're going to be able to help them just knowing what's going on in your genes. So if this makes sense, I behoove you, please call and schedule a consultation. You got nothing to lose, everything to gain. 708-614-1222. I got someone that I pay to answer 24/7. And please let them know that you watched the entire video so that I understand that you have a good understanding of all this. I'm Dr. Beyer. I hope you enjoyed it, and I hope to meet you soon.